Do you know how important it is to communicate as a nurse? I remember when I was about 8 or so, I was at my daycare of the time, and I was going down a slide at the playground. And I ended up hitting my head, and I ended up with a really bad head injury. And they took me to the hospital, and whenever I got there, I remember nurses and doctors above me communicating the whole time. They were saying stuff like, "Where's that IV?" And there were a few other things they said, but I can't really remember. If they didn't communicate effectively throughout my treatment, I may not have been here today. Communication is a huge part of the career of nurses. Nurses need an above average communication skills in order to be successful. Nurses are pretty much the communication centers of hospitals or doctors' offices. I was really amazed to see how much nurses actually communicate when I was doing my research. In this speech, I'll help you understand the amount of communication nurses actually have to do, and I'll also teach you about the responsibilities of nurses, which is actually pretty interesting. Nurses basically deal with everything in hospitals. If anyone has complaints, they have to deal with them. If there's any bad news that a patient gets, nurses have to deliver that news to them. Good communication skills are a must for all nurses. Otherwise, they won't be very effective when they have to deliver bad news or deal with a complaint. Nurses have to communicate with both patients, doctors, and their families. I'll start by talking about why nurses start questioning you the second you walk into the hospital. Nurses communicate with patients the second they walk into the door. The first thing they're trying to do is see what's wrong with the patient. They ask what kind of symptoms they've been having, and they ask some other miscellaneous health questions just to assess the patient's health. In addition, nurses communicate to patients how tests work and what the results mean. If a doctor orders a test, nurses have to explain what's happening in the test and what they're actually testing for. After the test, nurses bring the results to doctors for them to evaluate, and then the nurses then have to communicate to the patient what the results mean. Nurses are also communicating with patients when something good or bad happens to them. If they get good news, the nurse is there for them and they'll celebrate with them, have a good time. And if the patient gets bad news, the nurse has to tell them and they have to be there for them and be there with the family and the patient and help them cope with what's happening. On the other hand, nurses also communicate with doctors, according to Casey and Wallace. After nurses write down the patient's information, they take it to a doctor to evaluate, according to Casey and Wallace. Nurses also work with doctors in figuring out a diagnosis. The doctors communicate to the nurses the amount of medicine or any tests they have to run or anything like that. Nurses also have to communicate with doctors to see what tests or procedures needs to be done. When a doctor thinks a test needs to be done, they tell the nurse, and the nurse conducts or helps conduct the test needed. Also, if a procedure needs to be done, the nurses are in the operating room with the surgeons in case something goes wrong. Nurses also communicate with the families of patients, according to Corcuda and Papathanassio. Nurses have to tell the families of the patient if something bad happens with the patient. That's one of the hardest parts of being a nurse, which is what I read everywhere. You have to communicate to the family with empathy, and you need to be caring and compassionate with them, and just help them get through that time. And you also have to tell the families about any test results that come back. If they're bad test results, of course you have to be there, support the family. And if they're good test results, you get to celebrate and be happy with everyone. As I've made it clear in some of my other main points, nurses must have good interpersonal communication skills, according to Deo. Nurses need these skills when they have to deal with tough situations. The burden of delivering bad news to patients and families is put onto nurses. Nurses need to know how to communicate this news effectively and also to sympathize with the family and support them if they're in need of anything. Good interpersonal communication is also very important to have when you're discharging patients. Nurses must also communicate with anyone who has complaints. They have to respond to any safety incidents. Nurses must first apologize for what happened, and then they have to explain what happened and tell them that it'll never happen again. Ultimately, nurses pretty much deal with everything in hospitals that has to do with communication. They need to ask those initial questions to figure out what's wrong with the patient, help the patient and family cope with whatever happens, and of course deal with any complaints that people have. The importance of communication among all people in the hospital staff is unimaginable. With my story, I explained how when I went to the hospital, I heard doctors and nurses communicating the whole time I was there. If nurses didn't communicate with the doctors, most people who went to the hospital would not make it if their injury or illness was bad enough. However, even today, there are some nurses that are not effective communicators, and those nurses cause big problems in hospitals or doctors' offices. One of the articles I found actually had a training program for more effective communication between nurses. I believe that there should be many more of these programs to make our healthcare system the best it could possibly be. That is why communicating is so important to nurses.